Hello everyone, and thank you very much for joining us for this presentation on behalf of the GFF and Financing Workstream of the Advocacy and Accountability Working Group. And I'm delighted to share with you today two important presentations related to the work stream on financing and the Global Financing Facility. 2015 was an important year for financing, which included the Financing for Development Conference in Addis Ababa, changes to the ODA definition, and the implementation of the SDGs. And in 2016, the financial landscape is continuing to shift, and we as advocates need to understand what this means for RH supplies. So first we'll have a presentation from Karen Hoehn, who will present on Countdown 2030's recent research report, European Donor Financing of SRH and Family Planning on Non-Grant Development Financing Mechanisms. Countdown 2030 is a consortium of 15 European NGOs to safeguard and strengthen financial commitments and political leadership for universal access to reproductive health. And her presentation will seek to increase our knowledge on the growing field of non-grant financing and what it means for advocacy. Next, we'll turn to Richard Mugenyi from Reproductive Health Uganda, and he and his colleague Patrick from PPDRO will discuss CSO engagement in the GFF in Uganda. And their presentation will focus more on sharing lessons learned and the next steps on CSO engagement in the drafting of this GFF investment case and looking forward to the implementation of the GFF. And finally, we'll have a short intervention from Susanna Heard, who will overview the main elements of CSO engagement in the GFF at the global level. So we'll have 15 minutes for each presentation and a 5-minute intervention from Susanna, and then we'll move to questions and answers. So just to note that all participants are muted at the moment, and when the time comes for the discussion, you can type your question in the chat box on the screen, and Emily will be compiling questions and discussion points together at that time. But I ask that you reserve your questions and comments until after the presentations. So without further ado, I'm going to hand over to Karen, who will lead us in her presentation on non-grant financing.
Hello, everyone. Thanks very much, Erica, for the introduction. Since you've already very kindly introduced the Countdown 2015 Europe Consortium, that's what it was called last year, you'll see on the upper left-hand corner of this slide there's been a change in the logo because after 2015 they rebranded. This research, however, was done last year and completed in 2017. In 2015, in July, the data was all collected, and then the report was finalized later in the year with a summary made available this spring. As Erica mentioned, last year was a big year for financing. She's very kindly described some of the reasons for that, and in the interest of time, I'm not going to describe all the changes last year and all the important developments that took place, but merely say that with a lot of changes taking place in development financing, the Countdown Coalition, which has for years tracked ODA, official development assistance support for reproductive health and family planning, wanted to get a better sense of the broader picture of development financing and how it might be affecting reproductive health and family planning. So in order to cast a very broad net as a fact-finding mission, in the countries listed on the overhead you see there, Belgium, Denmark, Finland, France, Germany, Ireland, Netherlands, Norway, Spain, Sweden, Switzerland, United Kingdom, and the European institutions, we looked for development finance streams that met two main criteria. Number one, the financing stream had to be directed towards developing countries, so the resources were intended to flow in the direction of developing countries, or developing countries were certainly intended focus of the financing stream. And the second criterion was that some part of the financing mechanism would not be a grant. So anything that was not 100% a grant or a concessional loan was included. In the end, because as we were gathering this information, we found out some interesting information about concessional loans as well. So we have, for the sake of the full report, included information on concessional loans. But the definition of non-grant financing, which is what we were trying to scope out, is financing mechanisms that are directed towards developing countries and that include some amount of financing that is not a grant. In terms of overall findings, the first thing we found is that all of those countries do use non-grant financing for development finance, and that the volume of funds flowing through these non-grant financing mechanisms is growing rapidly and could soon rival official development assistance. All the countries made non-grant financing available for health, although in many cases the availability of those financing mechanisms for health was simply a matter of health not being excluded from eligibility. In other words, many of the non-grant financing mechanisms were not necessarily thematically focused, but also did not preclude that health companies or health entities could avail themselves of those forms of financing. And then 5 countries made non-grant financing available specifically for reproductive health and family planning, as you see listed there: Germany, Netherlands, excuse me, Norway, Sweden, and the UK were those 5. All different donors use different definitions, or there are wide variations in definitions of quote-unquote innovative financing and public-private partnerships and blended financing. You can find official definitions for some of these things. The OECD DAC provides some official definitions. The UN provides some official definitions. The EU provides some official definitions. But doing this research, we found that use by the different donor governments that were listed above varied widely. Having said that, the 3 main categories of non-grant financing, to make it as simple as possible, the 3 main categories of non-grant financing that we found were loans and debt types of financing. These included commercial loans, concessional loans, as I mentioned, impact bonds, either social or development impact bonds, and export credits. That was the largest type of non-grant financing by far, or at least the most common. The second major category is government guarantees. So these were often credit guarantees or risk guarantees. Many of you in the reproductive health supplies world have heard of volume guarantees. Some of you may have heard of advanced market commitments. In general, these sorts of guarantees tend to reduce the risk for companies to enter a developing country market. Risk that is preventing companies from taking that risk. So the government reduces the risk by guaranteeing some amount of either revenue or purchase, or some way mitigates the risk of the deal. And then the third major category of non-grant financing is government ownership, and that is when the donor government actually buys a stake in a company. It either buys equity, shares, it provides venture or risk capital. It takes some form of ownership share in the entity or company that is being financed through the non-grant financing mechanism. And here, more specifically, you see which countries were found to engage in which of these types of non-grant financing. Again, the most common by far is commercial loans. Almost all the donors that were researched do engage in providing commercial loans for development finance. Mixed instruments, these might be, in many cases, they were, for example, a grant combined with a loan, or a grant combined with a credit guarantee, or some other way of mixing these various instruments. Those in various ways were tried by many of them, 9 of the donor governments studied. Credit and risk guarantees, you can see there are 9 countries engaged in those. Equity, concessional loans, 8 countries are busy with those non-grant financing mechanisms. The last sort of major category there, venture and other risk capital, was also of great interest to the EU, Finland, Norway, Spain, Sweden, and Switzerland. And then the others, there was quite a bit of mixing and matching and sort of little pieces of work here and there in the other different subcategories. Why are donors interested in increasing non-grant financing? Private sector and other sources of financing have been growing very rapidly, while many donors have a sense that their ODA is sort of stagnating. ODA has been increasing in real volume for the most part over time, but at the same time private assets have been growing tremendously. And so donors would like to be able to find ways to turn the huge volume of private assets that are available out there, to turn those into development financing and to direct them towards developing countries in a way that they believe will promote at least economic growth, if not poverty reduction. Another major reason donors are increasing their non-grant financing, particularly as it pertains to loans and debt financing, is that loans enable donors to direct more resources to development than the government budget will allow. The reason for this is that lending agencies only have to have a small amount of actual capital available to them. They can loan many, many, many more times the resources. They can loan out a lot more money than they actually have in capital on hand. So donor governments can make a relatively small financial contribution that will enable a lending institution to lend a lot of money for development finance. Loans and equity are both perceived to be quite long-term and flexible approaches to development financing. They're not like a one-year grant or a two-year grant or a three-year grant or even a five-year grant. They tend to be much more long-term, and because loans are often given based on terms for a business model that is expected to be successful, the terms are often more flexible than sort of the grant financing that many of us are used to seeing. There's a general sense, although the evidence is a bit mixed and a bit difficult to tease out, but nonetheless, there is a general perception that trade is better than aid for reducing poverty. Donors believe that they can encourage more responsible commercial practices if they're engaging with companies that are getting involved in developing country markets. And there's also this notion that developing countries can benefit from integration into rich country value chains. So in many of these donor countries, they're fairly rigorous in terms of the standards they hold companies to in terms of their human rights and employment standards. And the notion is that by developing countries being integrated into these value chains, those benefits will be spread more widely. Many of these rationales are controversial, and many of the non-grant financing mechanisms are controversial, and there is a wide range of critiques and concerns. Here are a few of them. The main concern articulated largely by nonprofit organizations, by NGOs, is that by making development finance, by making taxpayer-funded, citizen-supported development finance available to commercial entities, you're in essence shifting resources that were intended for poverty reduction to those that already have quite strong capital assets. That's a major concern. Another concern often articulated is that loans and debt financing perpetuate poverty. Development finance institutions have been proliferating recently, and there are quite a few organizations such as Eurodad, the European Organization on Debt and Development, that has some concern articulated in quite some detail. They have a lot of technical expertise on the subject and have articulated quite some concerns around these issues. There are concerns articulated around how guarantees, the type of guarantees I described earlier, they may be considered to reward company failure, and the evidence indicates that without sustained support, not just a startup grant, but without sustained support, business and business partnerships in international, especially international businesses and business partnerships, have fairly high failure rates in developing markets. The World Bank and IMF themselves have found that when large institutions, when governments become large institutional investors, that they actually contribute to global economic volatility, which of course has a whole range of implications for development cooperation, for reducing poverty. And then one last major critique and concern I'll mention here that comes up quite often is that specifically for the sector of reproductive health, is that shifting from ODA grants, which are being directed to reproductive health commodities, to non-grant financing tends to shift away from health and away from reproductive health towards other sectors, the sectors more classically associated with many of these non-grant financing mechanisms, infrastructure, telecommunications, these sorts of things. So there is some concern by those in our community that a shift of these donors towards non-grant financing could shift resources away from reproductive health and family planning. The study recommends that donor governments establish clear assessment criteria, comprehensive data access, and independent evaluation. The study drew its conclusions and its findings based on publicly available information, and that information is not as comprehensive as it could be. It's not as detailed as it could be. It's not necessarily as clear as it could be. Oftentimes the level of detail is quite poor. And very few financing mechanisms themselves are subjected to independent evaluation for their cost effectiveness. Often independent evaluation is applied to program models, but not necessarily to financing mechanisms themselves. So the study recommends that donor governments do a better job in this area. Secondly, the study recommends that creditors, in particular, since loan and debt financing is so important, that creditors provide consistent, transparent, and verifiable information about how they make decisions about who gets loans, about where the money goes, what activities are funded through these loans, and of course what the impact is of them. And the last major category of recommendations for donor governments is that they fund research at the global level, at the national level, and at subnational levels to assess the genuine impact of development financing on poverty reduction. For advocates, some of the recommendations may be, for those who are advocates on this call, they might be a little bit more straightforward and obvious in the sense that as you often in these governments have different parties working on the financing, the non-grant financing mechanisms, than reproductive health and family planning advocates have been working with in the development agencies or in the health ministries. One first step is for reproductive health and family planning allies to approach their allies in government. So go to the health ministries, of course, go to the development ministries, and talk to them about the risk and opportunities presented by non-grant financing, so that you can go together with your allies that are in government to talk to the folks in the finance ministries that are to develop these non-grant financing mechanisms and approach them together. Of course, it's always important to emphasize the importance of transparency and accountability for work that's being done in non-grant financing. And given that much of the jargon and technical knowledge behind financing mechanisms can be very intimidating and off-putting for advocates, it's important to be confident and not off-put by that technical terminology and that jargon, and keep asking questions very simply until it's entirely clear. And you often find that in being persistent in asking the questions until it's completely clear, the next steps for advocacy become much clearer, which may not be clear during the first approach because the information that's provided may not be sufficiently detailed to make it clear exactly what the next step is. When conducting advocacy, emphasize ODA policy coherence. In general, development assistance is intended toward poverty reduction, and many of these non-grant financing mechanisms are focused more on economic growth. While those are not necessarily incompatible, they're also not the same. So it's certainly a reasonable line of argument that advocates could emphasize the importance that any development assistance funds that are applied to or combined with non-grant financing mechanisms should maintain their focus on poverty reduction as the principal aim rather than economic growth. Use the other messages and research that's available. Again, I point your attention to Eurodad. They have quite a lot of very good information available on their website. And come back again and again to the Code of Conducts for Development Effectiveness that have been agreed in financing, in development financing conferences over the past many years. So that's brief presentation. There's a lot more information that can be presented, but in the interest of time and keeping this short, I'll stop there and be happy to take any questions when the appropriate time arises. Thank you.
Thank you, Karen, and thank you for talking us through the emerging trend of non-grant financing. And I really enjoyed seeing your key recommended areas of action. I'm going to turn our attention over to the GFF now. And we have two colleagues from Uganda that were supposed to join us today. And we've been having some technical difficulties with getting them on the line and getting their presentation. but let's just check if we have Patrick and Richard on.
Hello?
Hi, Patrick. We can hear you. Please go ahead. The floor is yours.
All right. Thank you so much, and thanks for organizing this meeting. My colleague Richard from Reproductive Health Uganda should have sent and shared the presentation that we're going to be talking about. And I don't seem to be seeing him online already. Could you confirm whether Richard is on?
I'm not sure if Richard is on the line, and I haven't received a presentation from him yet. Emily, do you know if you can see Richard in the participants list?
No, Richard is not here.
Okay, maybe apologies for that. I know you could be having some issues with connections, but I could quickly give you some highlights of society involvement in the GFF process.
That would be great, Patrick. Please go ahead, and sorry for putting you on the spot, but it would be great to hear any impressions that you can share with us.
Okay, thank you. Largely to say that the initial involvement by civil society organizations in the developing the GFF was really very minimal, and the civil society was not in the know at all. But because of some intelligence information gathering we do here and there, we were able to know, especially from the Minister of Health, that a request had come from the World Bank for the proposal on the GFF. And therefore, as a civil society, we got to know that actually government of Uganda was considering turning the sharpened plan for reduction of maternal mortality to be a replica of the GFF, but we were very concerned that it had a very weak link to family planning. And therefore, with the support of advanced family planning, we were able to organize meetings as the family planning fraternity in Uganda to draw some strategies to which civil society can be enabled to comprehensively and elaborately participate in the GFF process. We also had a strategy of making relationships with the World Bank team and the consultants to making sure that the extent possible we get engaged in all the processes of developing the GFF. And therefore, a meeting was organized. World Bank consultants organized a meeting for the civil society in Uganda, and we got sort of the roadmap that had been drawn to develop the GFF, which sort of gave us some kind of information as to when and how we should be participating along the line. But clearly, at that point, the issue of family planning was still very weak. And again, we had to go back and convene meetings, reflection meetings among the civil society organizations. I made it very loud and clear that actually family planning was still not finding some ample space in the GFF, and we still have to continue making our noise very clear. We must commend the support that we received from UNFPA, because UNFPA was part of the drafting team, to which we can easily relate and are able to put our messages clear for honor transmission to the consultants and the World Bank team that was putting the GFF together. And for this, we are happy to state that although, of course, family planning has not gained a lot like maternal health has in terms of financing, we are able to mention that we are happy that family planning has also been prioritized in the GFF as to way. For now, that is what I can say, but I know that if Richard comes online, he should be able to add on what I've said. But I should, however, add on that we made a very quick one-on-one consultations with the civil society in Uganda, and this was spearheaded by PPDR, and we found that we were not actually on the same wavelengths in terms of understanding where we are and what kind of strategic thrusts the GFF was developing, and therefore we've been trying to engage with the Ministry of Finance and the Ministry of Health, particularly the Assistant Commissioner who is in charge of maternal health, to come and make a presentation for the civil society to know where we are in terms of the GFF and what kind of expectations we should be highlighting as civil society to make sure that the GFF is implemented in a coordinated way, both by the government and also by the civil society. We hope that this should enable us to have a very well coordinated implementation of the GFF, because the government itself also recognizes, and when they make presentation, they recognize the importance that civil society can play in terms of implementing this GFF as the way. I think for now that's what I can say, but I know that Richard will add on when he comes online. Hello?
Hi, thank you very much for that, Patrick. Really interesting to hear the ins and outs of CSO engagement in Uganda. I really appreciate that and appreciate you taking the floor quite suddenly. If Patrick, I'm sorry, if Richard does join us in the next little bit, we can turn the floor over to him. But at the moment, I'd like to turn over to Susanna Heard to talk to us a little bit about CSO engagement at the global level and work that's been done to ensure that CSOs are engaged at all levels of the GFF. Susanna, the floor is yours.
Great. Hi, can you hear me okay, Erica and everybody?
We can hear you.
Great. So hi everybody, my name is Susanna Heard and I work with Global Health Visions, and we're a small consulting group. We were asked last year, about this time last year, by Results to conduct a brief analysis of how civil society had been engaged in the GFF to date in the 4 front-runner countries, so in Tanzania, Kenya, DRC, and Ethiopia. As some of you might know, the GFF Investors Group, which is essentially like the board at the global level, has 2 civil society representatives, one from the Global North, one from the Global South. The Global North representative is Joanne Carter from Results, and the Global South representative is Mesfin Teklu from World Vision. And so Joanne from Results essentially asked us to do this analysis because I think that it was clear from kind of informal conversations that civil society engagement in the GFF at the country level had been quite weak, and yet I think others in the GFF sort of Secretariat and the World Bank were suggesting that perhaps it was going better in some countries, and I think that the point of sort of doing this analysis was really to highlight where the gaps had been and make some recommendations for improving civil society engagement moving forward. So we spoke to stakeholders in those 4 front-runner countries, and really the bottom line was that at that point we kind of were talking to stakeholders from about last October through December. It was pretty clear that civil society engagement had been pretty weak thus far. It was a bit better in some countries than in others, but generally speaking it was not very systematic, and there was a lot of problems with communication. So I'll just sort of run through some of the key findings that we heard and then what's happened since. Communication was a major challenge. That there was a real lack of kind of consistent and timely communication with civil society around GFF processes, around what was happening when there was opportunities to engage or be part of the process of developing the investment case. And then often when civil society did receive information, it was actually coming from their international partners rather than from partners in their own country. Sometimes it was coming through sort of personal relationships that people were able to leverage with the government and Ministry of Health, or real significant efforts on the part of civil society to try to sort of track down information. Another common challenge that we heard was just sort of the feeling of it being very rushed, so that in a number of countries, civil society sort of got last-minute information that perhaps there was some sort of consultation, but there was, very little advance notice, which hard to get to these meetings, to plan for it, to get civil society representatives, particularly from outside of capital cities. Another challenge was around resources, that obviously to support really meaningful civil society engagement, civil society needs to be resourced to participate, whether that's funds to get to meetings, to get to consultations, the time to really organize amongst civil society groups to come with a sort of more aligned list of priorities. Those kinds of things, as we all know, takes resources, and so that was something that has been a major barrier. In a number of the countries, there may have been one or two or a handful of civil society members that were consulted in the development of investment cases, but often that process of sort of who was consulted was not very transparent, or didn't seem to be very systematic. So perhaps someone was maybe sort of handpicked by someone in the Ministry of Health because of a personal connection, or it was very unclear as to how certain civil society representatives who may have been engaged were actually selected. And so obviously a need for a more kind of transparent process and ensuring that there's diverse representation of civil society members, so that that there are, obviously, as we all know, civil society is very diverse. There's lots of different issue areas. There's lots of different, there's implementers, there's advocates, there's youth, there's reproductive health and maternal health, and lots of different issues. And so ensuring some diversity of representation in consultation processes hasn't been strong to date, and is really something that needs to be improved upon. There was strong feedback that kind of country platforms or coordinating mechanisms for civil society to come together are extremely valuable, and that more of that would be very helpful to allow, like I said earlier, for civil society to come together and really align around what their priorities are, and kind of organize their input to the GFF process. And then finally, just we heard consistently that there was challenges in some countries around really recognizing the value of civil society contributions, and sort of a feeling in some countries that when civil society was engaged, that it was more a matter of checking the box to say, oh yes, we engage civil society, rather than real recognition of the value that civil society can bring to the GFF process. And I will say that that is certainly not the case everywhere. I think that we've also heard that perhaps governments don't know the right processes for engaging civil society, or need more sort of support in how to do that effectively, more time, more resources, all of those things that would help to kind of improve the process moving forward. So since this report was completed in February, some of the sort of recommendations coming out of this process were, I'm sure some of you are aware of the minimum standards for country platforms, which were developed by a number of civil society groups, and then shared with the GFF investors group at the global level as a recommendation of really how to clearly lay out what are the critical components of a strong country platform. So some of the things that already came up through the findings around clear and consistent and timely information sharing, selection of representatives through a transparent participatory process, accountability and independent review of processes and implementation, things like that. And so the minimum standards have been shared with the investors group and are supposed to be included in the GFF country guidance note, which is still forthcoming from the GFF Secretariat. We've heard that it should be completed any day now. It's something that will be shared with countries, and so we've heard that those minimum standards or some version of them will be integrated into that guidance note, but we don't know for sure. There is a global kind of CSO coordinating group that has been working together to try to enhance in the communication. There's a newsletter that now goes out every couple of months, and if anyone needs information on how to get on that list to be getting the newsletter, I'm happy to share that. And then the role of the global group is also to feed into the two representatives that are sitting on the global GFF investors group, so that there's a mechanism of trying to sort of gather input and feedback to feed into those two members, so sort of be clear about what they're advocating for as part of the investors group, to really try to enhance civil society engagement. We are aiming to do a quick update to the report to gather some input from other countries about how the process has been in terms of CSO engagement in some of the second wave countries, if anything has really changed since last year, because there is an investors group meeting coming up in November, and so trying to gather some of that input to really supplement the February report to share with the investors group in November, and again, hopefully just continue to push for this, the value of civil society engagement and really the things that need to be put in place to ensure that. And then finally, the private sector has a private sector engagement strategy for the GFF. This is something that was driven by the private sector representatives, or representative and by the private sector itself. And so there is a desire to do the same for civil society, and so that's something that is just getting underway and hopefully will also be developed over the coming months before the next investors group meeting, to have a kind of clear strategy for civil society engagement that takes some of the recommendations from our report, some of the learnings from countries that have been engaged in this process to date, and from other mechanisms like Gavi and the Sun Nutrition Movement and Global Fund, and really trying to lay out how to quickly a strategy for improving civil society engagement moving forward. I think I may have talked for more than 5 minutes, so I'm sorry about that, Erica.
Thank you very much, Susanna, and that was great to hear about the efforts that have been made at the global level. So thank you for that. We're going to turn now to the discussion part of our webinar. So as a reminder, if you'd like to ask a question or any particular thing that you'd like to discuss, please do type into the chat box on your screen, and Emily will be compiling some questions to our panelists.
Thank you, Erica. So just to mention that there's a specific box for questions, so it's not in the chat box but questions box, but I think you'll find it. There's also another way to raise your hand. You have this little small hand that you can click. We already got a couple of questions. So the first questions are for Karen, and there are two questions from John Townsend. So I'll give you the floor, John. John, the floor is yours. John?
Yes. Okay, I guess I'm open.
Yes.
The first question is, and maybe it was partly presented by Karen, to what extent are the non-grant financing linked to business interests in the sponsoring countries? Priti Patel in her earlier statements for DFID said that she was going to do a link these interests, whether it's vehicles or other interests in terms of national products to development assistance. Did you see any evidence for that, and what are some additional concerns about that? And the second is how, I missed the first minute or so of your presentation, how were the recommendations formed? Did they come out of your own analysis, or did they come out of other stakeholders as you went through collecting information? Thanks. Great presentation.
Yeah, thanks, John. Excuse me. On the question of how non-grant financing mechanisms are linked to businesses in developing countries, the donor countries that we looked at are all over the map. The largest trend was for there to be preference for companies from the donor country itself, and many of the governments are quite open and transparent about that as well. You know, the Netherlands aid for trade strategy and trade and aid strategy is quite explicit about that approach on their part, and several of the Scandinavian donors are as well, and the UK certainly is as well. So we found more of these to be available to European-based companies than developing country originated companies, but there were some that were made available specifically for developing country companies. In some instances that was a qualifying criteria, but we're talking about a wide range of different types of mechanisms by different donors, so there are different rules that will apply in each case, but in general yeah, it was mostly focused on the European countries. And how are the recommendations formed? Yeah, they follow pretty directly pretty simply from the research, and it followed from the analysis itself. There was a part of this research that I didn't present, but the research included a lot of components that aren't part of the public report and also aren't part of the this presentation, and that included very detailed donor maps that we provided to each countdown advocacy organization about what specifically the findings were in their countries. And there was also a part we tried to look at what are the best and worst practices that I hadn't presented today. Best and worst practices in relation to non-grant financing mechanisms, in relation to reproductive health and family planning. So one of the biggest findings is that it's very difficult to get good data, and there isn't much independent research. So the recommendation that governments make the data better available is a pretty straightforward one, because certainly civil society is going to be, if governments are going to be accountable to civil society, they have to make the information available for civil society to know what they're doing, and the information was just not at the level that facilitates that accountability activity very easily. I hope that's a sufficient answer to those questions.
Thank you, Karen. Now we have two more questions from Halima Sharif. Halima, I'm going to give you the floor.
Hi, Karen. Oh, I thought, Emily, I thought by tapping you would see that. You read it out, but it's okay. Thanks for the great presentation, Karen, and I'm going to combine just short questions that the NGF arrangement, I feel like it's certainly going to further tighten the noose around us, the Southerners, and I'm just wondering whether in your work you've noticed any like whether our governments even know about this situation, or maybe they don't even care, because I feel how much advocacy then would be required to just break through these mechanisms and arrangements, especially when our governments in the South are not so in tune with all this arrangement, or they are in tune and they don't care. And I'm wondering, this thing of rubbing on the value system, that if you make this kind of arrangements, then the institutions in the South are going to understand how they could operate commercially, if I got you right, but or professionally or efficiently and so forth. And coming from Tanzania, I feel like that's not even that rubbing into may not take place. I'm being a pessimist here. And lastly, we're having a GFF investors group meeting in the coming few weeks in Tanzania, and this is so critical information. Is this something that could we CSOs in Tanzania could read through this report and engage some of the GFF officials who will be there, because I know there will probably be a CSO forum that the GFF is trying to arrange. I mean, that's something I heard. I cannot confirm that. And this would be critical to at least dialogue and bring out some of these issues. Thank you.
Okay, I think I can talk now. Thanks for the question, Halima. It's a great question, and it's a huge question with a lot of stuff packed in there. I would say that this research was not focused on, you know, what this countdown research specifically wasn't focused on what developing country governments are doing. There have been other pieces of research that I've been involved in that have looked a little bit more at that issue. And I should mention as well, please forgive me, Sibylla Koenig was the other major consultant working on this piece of analysis with me. So I should have mentioned her name from the outset and forgot to. Sorry about that. But in any case, back on this, I would say, yeah, absolutely, Countdown is making the report available to those who request it. And there were many annexes as well, and those are also, some of those are available on request with more detail. So certainly I can connect you, Halima, with Anne Huybrechts or, you know, some of the other folks in Countdown who can provide the report and make it available for the GFF meetings. Some of the other analyses and reports that I would direct you to look at, I mean, some of the interagency analyses leading up to the Addis Ababa Action Agenda last year have a lot of very interesting information on what governments are doing, and some of those reports indicated that yeah, governments around the world are also, not just rich country governments, but also developing country governments are also trying to find ways to leverage private sector financing as much as possible for economic development and poverty reduction. So based on those reports, one could conclude that the governments are very much available. They may, I don't know how much they're available as to what the European governments are doing, but you know, there's certainly some awareness there. The other piece of research I've been involved in more recently that's about to come out, the Concord Europe Aid Watch report this year, Sibylla, Rebecca Webb, and I were the main authors for and did most of the research for. That's coming out any time in the coming few weeks to a month, and that has some additional findings in relation to, you know, how many of the European donor governments have put in place specific standards in relation to human rights in their private sector commercial strategies, private sector and commercial oriented strategies, and it's not very many that have actually put those sorts of standards in place in an explicit way in the programming for these financing mechanisms. So I would also tell you, you know, watch out for the Concord Europe Aid Watch report for this year, because that will also have additional information I think that will be helpful in this area.
Thank you, Karen. Next question is for Patrick and is from Erica. Erica, the floor is yours.
Thanks very much, and thank you to Patrick for the presentation. I'm wondering if you could mention on how CSOs are proposing any accountability around the priorities set in the GFF investment case.
Okay, thank you, Erica. As I mentioned during my submission, we have realized in the course of time that actually the greater part of the civil society do not have the same understanding of the investment case as it were. Of course, there are some who have been privileged, especially those big ones under the rubric of the Uganda Family Planning Consortium, who have been able to follow through the whole process. But we realize that as the civil society at large, we all need to be at the same page. So we have lined up a number of interventions, some of which point to efforts towards accountability and transparency. One, we are going to organize a meeting with civil society organizations under the rubric of the Uganda Family Planning Consortium to sort of discuss and generate consensus on what should really be the expectations of the civil society in terms of implementing the investment case. And here we're talking about a briefer. We want to have like a 1 or 2 page briefer, sort of highlighting the expectations as coming from the civil society in the context of the implementation of the investment case. We are going to ask, again, in another meeting, we are going to ask the Minister of Health and the Minister of to give some presentations about the status of implementation of the investment case. Because for now I can tell you that some might think that actually the process is still going on. When you inquire it from others, they think that the investment case is finalized and it is there for implementation. So we want to hear from those top dogs from the Minister of Health and the Minister of Finance, make a presentation on exactly where we are in terms of this investment case. After that, we have also organized to have a coordination meeting of civil society organizations, again coming together and sitting and charting a way forward in terms of accountability and transparency, making sure that we get to know how the whole process is going, not as it has been organized. We are planning to have an orientation meeting with the members of parliament, because if we are talking about issues of accountability and transparency, by virtue of their roles, be it representative, budget oversight, budget appropriation, we think parliamentarians need to be in the know regarding where we are in terms of the investment case and the mechanisms for implementing it. But having said that, we are working in partnership with the other implementing partners, notably FHI 360, to develop a comprehensive mechanism for tracking family planning program. This will be like sort of a one-stop center that should be able to give us the status of where we are regarding, for instance, all the 6 pillars of the costed implementation plan for family planning for Uganda. If we're talking about the demand generation, we should have a comprehensive framework, should sort of give us some pointers in terms of how we are in terms of demand creation. If we're talking about supplies, we should be able to know who is supplying, at what point, how, and by who. If we're talking about stewardship and policies, then we should be able to have a clear answer at the goal, whereby everyone will be able to visit this comprehensive framework and is able to give the same answer, same kind of response that would be given by any other person who is accessing it from whatever point. So this is a process that we have started, and actually I should mention that at the point we thought PPDR would spearhead this process of developing a comprehensive framework, we found that actually FHI had gone ahead to develop some kind of a framework that we are thinking of. So we are going to partner to make sure that you have it in place and duly owned by everyone. In order to get traction in terms of implementation by government, we are going to do some advocacy to making sure that this comprehensive framework for family planning is hosted and owned by government. So discussions whether we should have Minister of Health hosting it, or whether we should have the National Population Council that is in charge of coordinating the implementation of the population policy with the agency responsible for hosting this framework. But by and large, other voices are coming in that probably should be the office of the Prime Minister to do this. But by and large, you want government, strong government entity to host and own this comprehensive family planning framework. That's what I can say in terms of what I want to do in terms of accountability and transparency.
Thank you, Patrick. And then we go to Susanna. There is one question from John asking whether the report will be available online.
Hi, yes. So the report from February is already available online. And then the plans to do a little bit of sort of quick update and analysis of CSO engagement since last year will be just sort of a short memo as almost an addendum to the report. And yes, when it's completed, it will be made available online. But stay tuned. It should be hopefully done by the investors group meeting, which is November 3rd. So before that, just before that.
Okay, would be great if you could share that with us once it's available online. And
yeah.
I have one more question from my side. When there was at one point a meeting with the World Bank around the GFF in Brussels, and there was a World Bank representative joined by the private sector representative who together met all the people from the European Commission, from the permanent representations here in Brussels. And when we met with civil society, it was quite clear that it was the private sector was much more of a stronger position there. At one point, the private representative even mentioned that civil society should do more without always asking money for it. So the fact that they have funding to join, for example, for these kind of tours around Europe or for other meetings, it seemed at that meeting that it gives them much more of a stronger position also when it comes to being around the table at the end, and I would be interested to hear what your opinion is on that.
Yeah, it's a great point, and I agree with you 100%. I think that is you know, a major challenge that is faced by civil society. I think, you know, from the sort of perspective of the GFF, I think, you know, we've heard statements such as, oh, civil society needs to organize itself to engage, but we all know that that's very difficult to do without the resources to do so, both in terms of global and regional CSOs coming together as well as at the country level. You know, having those types of meetings, strengthening and working through consortiums that exist already or building new ones, mostly probably working through existing ones, you know, all of that takes time and money, and so it's been a challenge, I think, for civil society to be able to really engage in the same way. And similarly, this private sector engagement strategy that was developed, I think, again, what we've sort of heard was that when civil society said, oh, we see that there's a private sector engagement strategy, can we have one for civil society? The response was generally, sure, that would be great, but private sector led on this themselves, so civil society would sort of need to do the same thing. So I think that's a challenge that we're up against in trying to figure out how civil society can organize and as best as possible with, you know, very limited resources. At the same time, I think if we can continue to try to make the case for the real value of civil society engagement, you know, hopefully that is going to catch more of the attention of the GFF donor partners, as well as, you know, so, you know, it would be great if there was some sort of fund through the GFF to support civil society engagement. If that doesn't happen, I think also looking at individual donors who might be interested in, you know, supporting civil society engagement, and that's going to be our best approach to try to sort of combat that challenge.
Thank you. That was the last question, so Erica, back to you.
So thank you very much to everyone who participated, and thank you very, very much to our panelists. It's been a really great discussion, and we look forward to continuing the discussion in our regular workstream calls. Thank you.